A 79-year-old Balochi woman who has had a sudden episode of chest pain and shortness of breath, presented to an outside hospital and was found to have severe left main disease. And the right was normal, so she was referred for bypass. She didn't want a bypass, so this is her uh, angioplasty because she just refused totally. So there seems to be very tight narrowing. So it is difficult to get the guider in, but then we used a short guider, 3.3 millimeter, got this in, but then got a shot off, and you can see that it's not very clear. It's a big dominant type of a semi-dominant circumflex. She had a right dominant, so it's not a left dominant system. The wire did not go into the LED, and this is the reason why, because the LED was really subtotal here, and the wire would just deflect from here back into this high diagonal or ramus. So we tried to do this, but it was futile, so we then used a Gaia to get into this. So once that was done, we got access, and then there's the ballooning, multiple ballooning. We ballooned the circumflex as well, bifurcation, kissing balloon, and then finally got, you see, we had fixed this up, but there was still a lot of calcium, and we were keeping the rotablator at on backup, but we managed to do enough ballooning. So this is a stent which we got in with difficulty, and our gyro inflated it, crushed it. The plan was to do a DK crush towards and keeping the circumflex the main vessel because it was big. So we did all this. Then rewiring was a bit of a difficulty, but managed to do it with 1 millimeter, then a bigger balloon. Then we did the. So this was difficult. It was quite tight here, and it went up at 30 atmosphere. It opened up at 30 atmosphere. So this was very tight, but they managed to get it open finally. And so then a lot of kissing, preparation, and then this is the result. See, everything seems open, and then we use this 3.5 stent, placed it just at the ostium. Difficult to get the ostium mark, but managed to just about get it at the right place, and so you can see that we probably nailed it. So the NC, and then it was all pretty simple, pot with the 4, and then managed to do case, and then you can see that we used a bigger balloon to optimize the stents, and a lot of kissing and potting. So remember, this is a 79-year-old lady who has, so the circumflex looks okay, and as you can see, this also looks okay. The left main is hiding behind this, but the LED seems okay. And in this view, the left main seems okay. The left main, this seems pretty open, and in the previous view, you could see that I think it's okay here. We have gone up with 3 millimeter balloon at very high pressure, maybe at 10% residual here, but this seems okay. So just distal calcified left main in elderly, I still think we are probably less riskier than doing an open heart surgery.